Look at the number of pills this woman is taking for her sciatica. This is a real photo I saw on Facebook where this woman writes, "This is how hard I'm trying to get rid of this pain from hell." However, there's a big problem here. Popping pills requires no work, and relying on this many pills can lead to way worse problems. But how does someone end up at this point? Are there certain medications that could be helpful for sciatica? And ultimately, how can you achieve the best long-term results without relying on medications? My name is Dr. Grant Elliott, and we have helped thousands with back pain and sciatica fully recover through our one-on-one online coaching program. And in this episode, I'm going to teach you how to avoid falling into this medication trap, what the evidence says about sciatica medication, and the best approach to properly resolve this pain for life. So how does someone find themselves choking down hundreds of pills? It usually looks something like this. They wake up one day and realize that back or sciatica pain they've been feeling for the last few weeks isn't going anywhere. So they go to a local chiropractor, which ends up being a very typical chiropractor that just takes x-rays, tells you your spine is out of alignment, gives you some adjustments, then tells you to come back 3 times a week for the rest of your life. And of course, you don't see great results, so you go to the physical therapist, which ends up being a very typical physical therapist that just hooks you up to an ultrasound machine, tells you your glutes and core are weak, takes you through some super basic stretches, and watches you on the treadmill for 10 minutes next to 5 other people who also aren't seeing any results. All right, so now you feel like you've tried it all, and the pain is still there. And you can't live with this pain, so now you turn to the only thing you feel is left: pain medication. Maybe you start taking medication with the goal of just temporary usage to get you through a rough day, but then it feels a little bit easier to get through that day, and then you notice you take it the next day, and then it becomes a habit. And next thing you know, you're taking it every day. So now your pain might be less because you're living on medication, and now your motivation to go seek proper care is lower. This is how chronic pain and how people get stuck in this cycle for years. Then you build a tolerance to this medication. Start seeking more medication and vitamins and herbal pain relief alternatives, and now you're looking for anything to try to get you back feeling the way you were. And next thing you know, you're the lady in this Facebook photo literally taking hundreds of pills trying to get rid of her sciatica. This has to stop. Now, I want to be clear, I feel genuinely bad for this person. I got into healthcare to help people. We talk to hundreds of people every week, some of which are in really tough situations, and we genuinely feel for them. So I'm not insulting her. She's just doing what she knows, and she's just trying to reduce her pain like all of you watching this video. But that doesn't mean it's the right approach. Hey, real quick, I know you're struggling with pain and obviously want to fix it. So if you just text me the word pain to 317-751-9509, I will send you my free back pain fix demo. Just text that number and you can fix your pain. Thank me later. Back to the show. So before I discuss the right approach for sciatica, let's first look at what the evidence even says about medication for sciatica. The drugs primarily prescribed for sciatica are NSAIDs, non-steroidal anti-inflammatory drugs, corticosteroids, antidepressants, anticonvulsants like gabapentin most commonly, muscle relaxers, and opioids. A systematic review from 2012 found all of these to provide only some short-term relief, but no long-term efficacy. In fact, some studies found NSAIDs to be comparable to placebo, and some advised NSAIDs to no longer be approved for human consumption. High consumption of NSAIDs can lead to delayed healing, gut issues, digestive issues, and of course lead to a medication-dependent based mindset that we were discussing earlier. And then of course, moving towards heavier painkillers like opioids, we all know the dangers of opioids, and this is still a real problem today. Overprescribing opioids, getting people addicted to opioids, and not only leading to chronic pain, but whole types of other issues in their lives and performance. So let's avoid the drugs, get off the drugs, and move on to a real plan. It is shown time and time again that the best treatment for sciatica is a specialized rehab plan. Very few cases of sciatica require surgical intervention, and we've canceled thousands of surgeries. And very few cases of sciatica require injections or medications. The best approach for sciatica is to first determine which exercises will help get the pressure off the nerve. And I'll explain a few methods we use with some of our clients all over the world using our centralization process. For many of our online sciatica clients, this typically starts out by finding a specific direction the spine wants to move. It might be loading the spine into extension, flexion, lateral glide, or rotation. We may then also focus on movements that take pressure off the nerve root directly or mobilize the nerve. Once your sciatica symptoms start centralizing, meaning they're reducing out of the leg, then we advance the exercises that started this process. Then we begin loading your core and your spine through various core and spine exercises, eventually progressing to squat and deadlift variations without any pain within just a few short months. When handled properly, you can reduce years of sciatica in as little as 30 days in some cases. So if you you want to dive deeper with me and actually get a structured plan to healing, I've got something for you. Just text me the word pain to 317-751-9509 to get a tailored step-by-step plan to permanently fix your back or sciatica issues following our centralization process. Do it right now so you don't miss this opportunity to finally get out of pain, live the life you deserve, and stop making excuses that are keeping you stuck. Please like the video, subscribe if you haven't already, join my private Facebook group, RehabFix Low Back Program, for more free content, resources, and guides. Thank you so much for watching. I'll see you on the next one.